Hello everyone, welcome into the my video channel. Today our video topic is COVID-19, a risk for human life. So here we are going to discuss the background of coronavirus. Coronavirus comprises a vast family of viruses, 7 of which are known to cause disease in humans. Human coronavirus were first identified in the mid-1916. Coronavirus 19 is likely one such virus postulated to have originated in a large animal and seafood. Several acute respiratory syndrome and Middle East respiratory syndrome are also caused by coronaviruses that jump from animals to humans. More than 8,000 individuals developed SARS, nearly 800 of whom died of the illness before it was controlled in 2003. Now we are going to discuss about coronaviruses. Coronaviruses are a group of related viruses that cause disease in mammals and birds. In human, coronaviruses cause respiratory tract infection that can range from mild to lethal. Coronaviruses are believed to cause a significant percentage of all common cold in humans. Coronaviruses cause cold in humans primarily in the winter and early spring season. Coronaviruses primarily infected the upper respiratory and gastrointestinal tract of mammals. Different types of coronaviruses. Here, coronaviruses are divided into the two groups. The four common ones are 229E alpha, NL63 alpha, OC43 beta, HKU1 beta, and other three less common ones are MERS, SARS, and SARS-CoV-19. MERS is also a beta virus that causes Middle East respiratory syndrome. SARS is also a beta virus that causes SARS acute respiratory syndrome. And SARS-CoV-19 is a most infectious virus. In this scenario, we are also suffering with this virus. What is COVID-19? COVID-19 is an infectious disease caused by several acute respiratory syndrome coronavirus 2. The disease was first identified in December 2019 in Wuhan, the capital of China, Hubei province, and has since spread globally, resulting in the ongoing 2019 to 2020 coronavirus pandemic. Coronavirus is most contagious during the first 3 days after onset of symptoms, although spread may be possible before symptoms appear and in later stages of the disease. There are currently 2,404,820 confirmed cases and 164,922 death cases and 624,849 recovered cases from the coronavirus COVID-19 outbreak as of April 19, 2020. Here is the reported case and death by the country. You can see The most cases comes from USA, then Spain, Italy, France, Germany, UK, Turkey, China. So many cases, so many countries are suffering with this coronavirus 19. Luckily, our India is suffering a lot, but as compared to other country, our condition is less harmless. So now we are going to discuss about the route of transmission. A respiratory infection can be transmitted through droplets of different size. When the droplet particles are greater than 5 to 10 micrometer in diameter, they are referred to as a respiratory droplets, and when then are less than 5 micrometer in diameter, they are referred to as droplet nuclei. COVID-19 virus is primarily transmitted between people through respiratory droplets and contact routes. Droplet transmission occurs when a person is in close contact within a 1 meter or with someone who has respiratory symptoms like coughing or sneezing and is therefore at risk of having his or her mucus like mouth or nose mucus or conjunctiva like eyes exposed to potential infective respiratory droplets. Here we can understand the route of transmission, like this is the infected individuals, and when the infected individuals sneeze, the droplets can be spread from in different modes like direct contact, indirect contact, and airborne through airborne. So other healthy person can be infected by this coronavirus also. COVID-19 virus can occur by direct contact with infected people and indirect contact with surface in the immediate environment or with objects used on the infected person. Now, what is the incubation period of COVID-19? Novel coronavirus COVID-19 incubation period is observed almost 2 to 14 days or 0 to 24 days. The incubation period of COVID-19 is thought to extended to 14 days with a medium time of 4 to 5 days from exposure to symptoms onset. One study reported that 97.5% of persons with COVID-19 who develop symptoms will do so with 11.5 days of SARS COVID-19 infection. The signs and symptoms of COVID-19 present at illness onset vary, but over the course of the disease, most persons with COVID-19 will experience the following things like fever, coughing, fatigue, anorexia, shortness of breath, sputum production. And here you can see the percentage level. Most of the people serve the fever. It could be 83 to 99%. Coughing scenario can be 59 to 82%. Fatigue 44 to 70%. So now we are going to discuss about the structure of coronavirus. Virologist knows from studying it close cues in viruses that cause SARS and MERS that the spike interact with receptor on cell like key in locks enable the virus to enter. The carbohydrate of the sugar dot, which found outside of the spike, make the virus more difficult for the human immune system to recognize. Coronavirus are enveloped non-segmented single standard positive sense RNA virus named after their corona or crown-like surface projection seen on electron microscopy that correspond to large surface spike protein. What are the symptoms? This is the main thing. Without knowing the symptoms, how we can know we are infected by the coronavirus? The infection period may be 1 to 2 days before symptoms appear, but people are likely most infection during the during the period, even if symptoms are mild and very non-specific. The infection period is now estimated to last for 7 to 12 days in moderate cases and up to 2 weeks on average in severe cases. Some common symptoms that have been specifically linked to COVID-19 included shortness of breath, having cough that get more severe over time, a lot grade fever that gradually increase in temperature. These symptoms may become more severe in some people, like trouble breathing, blue lips or face, severe pain or pressure in the chest, confusion, excessive drowsiness. So now we are going to know about the increased rate for coronaviruses. The COVID-19 virus infected people of all ages. However, evidence to date suggests that two groups of people are at a higher risk of getting served with COVID-19 disease: older people and those with underlying medical conditions like lung conditions such as COPD and asthma, certain heart conditions, immune system conditions such as HIV, cancer that require treatment, so obesity, diabetes, kidney disease, or liver disease. After at the high risk, you are at the high risk for con- contracting SARS COVID-19 if you come into contact with someone who carry it, especially if you have been exposed to their saliva or been near them when they have coughed or sneezed. If you have been intimate with such a partner who have contracted the viruses. So here you can see difference between the coronavirus, flu, cold and seasonal allergy. Like length of the symptoms of coronavirus could be 7 to 25 days. Cold is less than 14 days. But in flu, this length of symptoms is only 7 to 14 days. And seasonal allergy may be severe weeks only. So you can see this chart and you can see the differences in COVID-19, cold, flu and seasonal allergy. Now prevention. How can I avoid getting infected? The virus enters your body via your eyes, nose, mouth, so it is important to avoid touching your face with unwashed hand. Washing of hand with soap and water for at least 20 seconds or cleaning hand thoroughly with alcohol-based solution. Stay 1 meter or more. Stay 1 meter or more away from people infected with COVID-19 who are showing symptoms to reduce the risk of infection through respiratory droplets. Now, how you can avoid infection from infecting others? Cough or sneezing into your elbow or use a tissue. If you use a tissue, dispose of it carefully after a single use. Wash your hand with soap and water for at least 20 seconds. Stay 1 meter or more away from people to reduce the risk of spreading the virus through respiratory droplets. If you feel unwell, stay at home. If you develop any symptom suggestive of COVID-19, you should immediately call your healthcare provider for advice. Now, the topic is face mask effects. Is face masks effective in protecting against COVID-19? In fact, it is possible that the use of face mask may even increase the risk of infection due to increased contact between hands, mouth, and eyes while wearing them. The inappropriate use of masks also may increase the risk of infection. Experts recommended that healthy people do not need to wear face masks unless they are caring for someone who is ill with the new coronavirus. But it's a smart idea to um, don a face mask or wrap a clean scarf around your nose and mouth if you are going into a crowded place during the COVID-19 outbreak. Now question is this, why soap is good at killing COVID-19? Soap is made up of two side molecules. One side is attracted to water, the other side is attracted to fat. Viruses sorry Viruses are made up of material surrounded by a coating of protein and fat. When viruses interact with soap, that fat containing gets ripped out by the soap molecule. Soap literally demolishes viruses as the outer layer dissolves, the virus fall apart and die. But yes, it takes time for this effect to happen, at least 20 seconds to be specific. Now, how to clean your hands to protect against coronaviruses? Here's the 7 steps to wash your hand. First, take the right amount of gel. Second, palm rub against each other. Third is rub the back of the palm. Fourth is finger crossed. Fifth is interlocking fingers. Six is scrub the thumbs, and one is scrub your fingertips. Now, is hand sanitizer effective against COVID-19? Alcohol attack and destroy the envelope protein that surrounds some viruses, including coronaviruses too. But a hand sanitizer need to be at least 60% alcohol in order to kill most viruses. Also, when you use hand sanitizer, make sure you do so the right way. This takes about 20 seconds. Be careful not to wipe the sanitizer off before it's dry. Doing that can make it not effective in killing germs. Now, drugs being tested against the coronaviruses. So many drugs are tested for the coronaviruses, but in these days, doctors hope will help fight with coronaviruses with almost these four type of drugs. First one is antiviral EIDD 2801. The drug might even be more effective at blocking the novel coronavirus SARS-CoV-2. This drug is an oral drug which makes this treatment more desirable, especially as a prophylaxis that can be administered outside a clinical setting. Now, second drug is favipiravir and Avigar. This drug has been used in Japan to treat influenza, and last month this drug was approved as an experimental treatment for COVID-19 infection. These drugs work by preventing certain viruses from replicating, seems to shorten the duration of the virus as well as improve lung condition in tested patients. So here's the also we can discuss about the chloroquine and hydroxychloroquine and lopinavir and retrovirus plus interferon beta, also very effective in the coronavirus 19 treatment. Why does COVID-19 vaccine production take so long? There are many steps involved and a lot of regulatory hurdles to jump through. The process can be broken down into 6 phases. First one is vaccine design. Scientists study a pathogen and decide on how they will get the immune system to recognize it. Second phase is animal study. A new vaccine is tested in animal models for disease to show that it works and has no extreme adverse effect. Third phase is clinical trials. This is phase 1. These represent the first tests in human beings and test the safety, dose, and side effects of a vaccine. These trials only enroll a or small of the patients. You can say for the testing purpose only doctors or research team use only a small animals. So now the fourth phase is clinical trials. This is called phase 3, phase 2. This is a deeper analysis of how the drug or vaccine actually works biologically. It involves a larger patients and assess the physiological response and interaction with the treatment. For instance, a coronavirus trial may assess if a vaccine stimulates the immune system in a certain way. Fifth process is a clinical trial, is called phase 3. The final phase of trials seen an even greater amount of people tested over a long period of time. Now the last phase is regulatory approval. The final hurdle sees regulatory agencies like the US Food and Drug Administration, the European Medicine Agency, and Australia Therapeutic Good Administration take a look at the available evidence from experiments and trials and conclude whether a vaccine should be given the all clear as a treatment option. Hope all of you enjoy this video. Thank you for your attention. If you really enjoy this video, then please like and subscribe my channel. Thank you again.